Well, thank you very much. Thank you very much, especially to Jay for making it possible for us to talk in these meetings. Also to Adolfo, who has worked a lot to organize this Buenos Aires Congress. I didn't realize that so many people could come to Buenos Aires. You know, we almost was born here, so I feel at home here. So don't worry. So let me introduce myself. I am Juan Silanes. I am the founder of Inosan, which was founded 7 years ago, a pharmaceutical company specialized in antivenoms. And when I mean specializes, only makes antivenoms. Inosan has been born in Mexico, but as a matter of fact, the initial reason to exist for Inosan was Africa. And I would like to mention two people who have been decisive in this story. Cassian Baum died 8 or 9 years ago, and the late head of the Sanofi Institute Pasteur Venom units, and Jean-Philippe Chipot, who asked for help in 2000 to aid Africa who didn't have any antivenoms. Several years ago, these two people were manufacturers about the antivenom crisis in Africa and the terrible consequences on public health. But they were right. This is why today, several years after, we have one of the main products of Inosan is Inosan Pan-Africa. So we have to create that. A polyvalent antivenom dedicated to snakebite anti-envenomation in sub-Saharan Africa. This antivenom is a result of years of collaboration with clinical experts on the field of antivenom research, and I would like to especially mention Alejandro Aragón, who has been instrumental in the development of Inosan Pan-Africa, but also other antivenoms developed afterwards. This is not the only one. Inosan Biopharma is quite a small company, but has a great ambition that no one should suffer or die as a consequence of envenoming. To fulfill this commitment, Inosan has built brand new manufacturing facilities which have been GMP certificated by different competent authorities. That has been a great problem. Thanks to the latest available technologies, Inosan Biopharma has developed a new generation of antivenoms which are lyophilized, polyvalent, highly purified immunoglobulin fragments F82 and covering with high specificity the medically important species for a given region. That has been a great job. In addition to Inosan Pan-Africa, Inosan is currently distributing two other antivenoms. One polyvalent snake antivenom for the MENA region called the Inosan MENA, and also another polyvalent antivenom against scorpion venom for the MENA region. As Inosan wants to serve needs for everywhere, we have other products in development stage, including one product dedicated for snake envenoming in South African region, and another product to cover viper envenoming in Europe. As remembered by many speakers, during these past days, we are all here for one ultimate goal: to save lives, to avoid permanent disabilities related to envenoming. That's why we think it is crucial to be able to properly assess the clinical benefits to our antivenoms. Sorry, because it's more institutional, I prefer to read. In addition to the several clinical studies that we have already been performed, we are very happy to announce today that Institut Pasteur is launching this week a multi-center study in Cameroon to assess the safety and efficacy of Inosan Pan-Africa. This study will involve almost 500 patients in Cameroon. As you know, safety is critical for antivenoms and has been a real issue for a long period of time, especially for the first antivenom produced in history. Thanks to the specific manufacturing process developed by Inosan, antivenoms are composed of very pure antigen-binding immunoglobulins fragment FAB2, more than 90%, and a low protein level content. As a consequence, Inosan antivenoms have a very good safety profile, as recently reported in a review of the clinical data on antivenoms use in sub-Saharan Africa, published lately. Although great progress has been made over the last few decades in the manufacture of antivenoms, these efforts have not always been recognized and highlighted. We can state today that antivenom production has left the field of artisan biologicals, de facto entering in the sphere of biotech. However, it takes time to change minds. For example, the same antiserum is still widely used, even though the modern antivenom bears as much resemblance to antiserum as pure penicillin to a crude extract of modified bread. This is why efforts invested in educating and training healthcare workers are pivotal for restoring confidence in antivenoms. Optimization, product selection, and use of trigger the transformation of the vicious circle into a virtuous circle to reduce death and permanent disabilities associated with snake bite envenoming. At Inosan Biopharma, we have put in place an educational program in countries where our products are available. And that's, I would say, that's the biggest task that no one alone can do. This is have an educational program for people, for governments to take advantage of what WHO is doing, what manufacturers are doing, and to avoid all these uncertainties about the efficacy of the antivenoms, and to teach doctors how to use them. One big challenge for manufacturers is that, in the other hand, antivenoms are quite complex and expensive to produce. But on the other hand, antivenoms have to be affordable for all people, especially in developing countries. Our technology has allowed us to manufacture large batches with less venom, and as a result, our products are one of the most cost-effective antivenoms available today. That's the idea to have cost-effective products. Last but not least, thanks to its lyophilized formulation, the transport and storage of Inosan antivenoms are not cold chain dependent. This makes the management of antivenoms very convenient compared with liquid antivenoms, particularly in tropical regions. Inosan Biopharma is proud to provide antivenoms to WHO now, especially in Middle East, and is keen to collaborate with WHO and all key players in the field to have the number of to halt the number of victims of snake bite by 2030. Indeed, no one should suffer or die as a consequence of our animal environment. Thank you very much for your attention.